Elotuzumab is a first-in-class monoclonal antibody that targets SLAMF7, an antigen highly expressed on plasma cells. Therefore, it has a unique mechanism that combines selective SLAMF7 binding with the activation of natural killer cell-mediated antibody-dependent cellular cytotoxicity, making it an appealing therapeutic option for patients with multiple myeloma. In view of the variability in clinical outcomes observed across previously published studies and the limited retrospective data on the real-world safety and efficacy of elotuzumab-based regimens, we performed an updated meta-analysis of randomized trials evaluating the addition of elotuzumab to backbone anti-myeloma regimens. In our study, which included more than 2,700 patients from 8 randomized trials, the addition of elotuzumab to standard anti-myeloma regimens significantly improved progression-free survival, overall response rates, and a rate of very good partial response or better among patients with relapsed refractory multiple myeloma. However, unfortunately, no efficacy benefit was observed in the newly diagnosed multiple myeloma setting. Although elotuzumab in our safety analysis was associated with an increased risk of severe infections, it did not significantly affect rates of severe cytopenias, severe cardiac disorders, or second primary malignancies, which is somewhat different than other options available for treatment of relapsed refractory disease. Based on these findings, we identified 3 key takeaways for clinical practice. The first one is that elotuzumab remains a valuable therapeutic agent for overcoming multi-drug resistance in heavily pretreated patients with multiple myeloma, including patients with high-risk cytogenetic abnormalities. Second one is that given the lack of observed benefit in newly diagnosed multiple myeloma, elotuzumab-containing regimens may be more appropriately reserved for later lines of therapy rather than for upfront treatment. And our third key takeaway is that the increased risk of severe infections associated with elotuzumab warrants vigilant monitoring as well as preventive strategies in clinical practice, such as antibiotic prophylaxis for patients eligible for that, such as IVIG infusion, and furthermore, additional research is needed to refine the use of elotuzumab, particularly in combination with other novel immunotherapies. And maybe as it differently from other agents that target BCMA, it would not lead to a significant impact in the level of BCMA expression for patients who receive CAR-T, and could be potentially a good agent to use for bridging therapy before CAR-T.